with the 2 new cases that have been reported in Edmonton, the level of concern now that many of kids in many provinces are going back to class.
Yeah, but I think we have to remember, too, that the vast majority of Canadians are up to date on their routine childhood immunizations. And when we look at the outbreaks of measles, especially in Canada and other high-income countries, the infections are predominantly in unvaccinated individuals. So if some kids are going back to class, of course, nobody wants to have an exposure to measles. But if people are up to date on their routine childhood immunizations, the risk is incredibly small. The real issue here is that there's pockets of undervaccinated individuals and communities with undervaccinated pockets in the country. And when measles enters those pockets, it exploits them. It's one of the most transmissible infections out there. And it has a knack for finding unvaccinated people because it's so transmissible. So that's the real issue here.
You mentioned, of course, the vaccination rates, but in the meantime, parents that might be concerned, what's your advice to families right now?
Listen, it's routine childhood immunizations are called routine because they're routine, right? Everyone should be up to date on their routine childhood immunizations, and that includes the MMR vaccine, which is known as the measles, mumps, and rubella vaccine. That's one of several vaccines that are routinely given. The first dose is given at the age of 1. The second dose is around 18 months to before a child enters school. It's just best to be up to date on your routine childhood immunization. So A, we don't get these infections at an individual level, and B, we don't see outbreaks at a community level like what we're seeing right now.
Dr. Bogoch, infectious disease specialist, thanks so much for your time. Appreciate it.
My pleasure.